In this video, I'm going to talk about the importance of lead hip internal rotation as it pertains to the golf swing. We're going to look at an amateur golf swing and a professional golf swing and look at the differences between their lead hip internal rotation and how that might affect your biomechanics. We'll also go over some techniques from the Postural Restoration Institute that will help you safely increase your lead hip internal rotation.
One of the ways we like to measure if a player has adequate lead hip internal rotation is by drawing a line at the back of their hip at address. This is a very good amateur player, scratch player. He does a decent job of keeping that hip on that line as he should on the backswing, but as he veers towards impact, those hips come off that line, showing it's hard for him to actually load and get into that left hip. So he has very good timing with the swing, but this can lead to early extension and some blocks and hooks with most amateur players if the timing is off, if you don't have adequate lead hip internal rotation. Now looking at world number one, Scotty Scheffler. He does a very good job of keeping his hip at that line, even going past that line on his backswing and coming towards impact. He maintains that position with his hip, rotates through and gets that left hip at that line so he can clear his hands. And again, I'm not looking at the biomechanics of either swing, but just the physical capabilities of the two players. And this is one of the biggest differences we see between pros and amateur players, is having adequate lead hip internal rotation and getting that left hip behind that line. So now we'll go over some techniques from the Postural Restoration Institute that will hopefully help you safely increase lead hip internal rotation and help you play some better golf. First exercise to help improve lead hip internal rotation for golfers is entitled left adductor pullback. We must first stretch that posterior hip capsule of the left hip before we can truly get that force coupling between the femur and acetabulum to really improve strength and internal rotation in that lead hip. To perform this exercise, you're going to lie on your right side at a 90-degree angle from your ankle, knee, and hip, and you want to bolster in between your feet and a towel rolled up about 2 inches in between your knees. You want to make sure your back is flat and your belly button is drawn in. Make sure you're not rotating your trunk in one direction or the other, and you want to make sure your neck is relaxed. You're going to take a deep breath of air in through your nose. Exhale out. You're going to push your right foot into the wall and set up into the position. From there, you're going to breathe in again and proceed to shift back into that left hip. And as you exhale, you're going to push down into the towel and hold for about 5 seconds. Each time you perform this exercise, you want to keep shifting back in that left hip. So you don't want to go back and forth. On each breath, you're going to proceed to shift back in that left hip. And you should feel a stretch in that posterior hip capsule, and you should start to feel that left inner thigh engage. You're going to repeat this for 4 to 5 breaths. The next progression to improve lead hip internal rotation is called left adductor pullback with passive FAIR. So you're going to start at a 90-degree position with your knees and hips. You want to make sure your back's flat. You want to make sure your neck is supported. You're going to have about 6 inches between your left foot and your right foot, and you're going to have a little towel rolled up about 2 inches in between your knees. You're going to make sure that left heel is pulled back into the wall to engage the hamstring. You're going to take a deep breath of air in through the nose. And as you do that, you're going to shift back in that left hip. Then as you exhale, you're going to push down on the towel. And that's going to really get that femur. You want to make sure as you're performing this exercise that your knee isn't coming up on the exhalation or that you're going forward. You want to make sure that you keep shifting back into that hip and you feel that left inner thigh engage. Third and final progression of improving left hip internal rotation is called left adductor pullback with left glute med. So again, we're in the same position, 90-90 on our right side. This time we're going to have a mini ball in between the knees. You're going to start with about 6 inches of separation in between your right foot and left foot, and you're going to push your right foot into the wall. Make sure that your neck is relaxed as always. So to start, we're going to take a deep breath of air in, exhale out, lightly push into the ball, and we're going to do this probably for about 2 breaths. And once we get into the right position, you're going to pick up your left foot off the wall, then you're going to move up and down and internally rotate through the hip. This is really going to help you work that glute med, which helps you stabilize that femur and internal rotation.